Imagine your body is a fortress, valiantly fighting off an invading army. When you have the flu, this battle is already intense, demanding all your defenses. So, what happens if you introduce something that weakens your walls and makes the fight even harder? You should definitely avoid tobacco in all its forms when you have the flu because it significantly harms your body's ability to recover and makes your symptoms much worse. The influenza virus primarily attacks your respiratory system, and tobacco products, whether smoked or vaped, directly damage these very same airways. For example, nicotine and other chemicals in tobacco paralyze and destroy the tiny hair-like structures in your lungs called cilia. These cilia normally act like tiny brooms, constantly sweeping out mucus, dust, and pathogens. When they are impaired, mucus builds up, trapping viruses and bacteria, which creates a perfect breeding ground for more serious infections. Beyond local respiratory damage, tobacco use also suppresses your overall immune response. This means your body is less efficient at identifying and eliminating the flu virus, leading to a prolonged illness and a greater chance of complications. Your white blood cells, the critical fighters of infection, become less effective when constantly exposed to tobacco toxins. This double whammy of damaged physical defenses and a weakened immune system makes fighting the flu an uphill battle. Furthermore, tobacco use constricts blood vessels and reduces the amount of oxygen that reaches your tissues. Oxygen is vital for cellular repair and regeneration, especially when your body is under stress from an infection. Less oxygen means slower healing, increased inflammation, and a general feeling of being unwell, intensifying symptoms like fatigue, body aches, and shortness of breath. The simplest and most effective how-to during flu season is a complete cessation of all tobacco use. This includes traditional cigarettes, cigars, pipes, and smokeless tobacco, as well as electronic cigarettes and vaping devices. Think of it as giving your body the best possible chance to heal without additional burdens. If you find it challenging to stop completely, even a temporary break can make a significant difference to your recovery. It is also important to avoid exposure to secondhand smoke from others. If you live with people who use tobacco, kindly ask them to do so outside your home to ensure the air inside remains clean and does not aggravate your already sensitive airways. Protecting your immediate environment is a key step. Consider that scientific studies consistently show individuals who use tobacco products often experience more severe flu symptoms, face extended recovery times, and have a substantially elevated risk of developing serious secondary infections, such as bacterial pneumonia. This heightened risk is not just theoretical. It is a well-documented clinical observation directly linked to the cumulative damage tobacco inflicts on the respiratory and immune systems, making healing much harder. By completely avoiding tobacco during your flu illness, you provide your body with the optimal conditions to mount a strong defense and repair itself. This thoughtful decision supports a quicker, less painful recovery, minimizes the chance of dangerous complications, and helps you return to full health sooner rather than later. It is one of the most impactful choices you can make for your well-being when battling the flu.